If you have sprained your ankle recently or you have chronically weak ankles from recurrent ankle sprains, this is the video where I will outline the most commonly prescribed exercises that I use in my clinical practice as a physical therapist to address just that. There are generally three types of ankle sprains. We have the lateral low ankle sprain, which usually involves inversion and supination. We have the medial ankle sprain, which usually involves eversion, pronation, and dorsiflexion. And we have the lateral ankle sprain, which usually involves tibial internal rotation, foot abduction, pronation, and dorsiflexion. The course of action for your rehab plan will differ depending on how you sprained your ankle as well as the severity of that ankle sprain. Just a disclaimer that all of my videos are intended for informational purposes only and should not be used as medical advice, so if your ankle sprain was recent or you are in a lot of pain right now, definitely go seek medical attention before attempting any of these exercises. But if you do want to strengthen your ankles to prevent recurrent ankle sprains, here are my best go-to exercises that I prescribe on the daily for my clients after an ankle sprain. So the first exercise that I'll show you is the banded ankle eversion, because the most common ankle sprains that happen typically are lateral ankle sprains, rolling your ankle like this. So to combat that, you want to strengthen that outside of the ankle as much as possible. To do this, if you don't have something you can anchor it to, you can always anchor it to your foot. This is the most efficient way to do so. Keep the heel on the ground, pull it outwards. So I like to call this pulling it out and up. So don't move the hip, don't move the knee, pull it up and out, hold it for 3 seconds, come back in slow, pull it out and up, 3 seconds, come back in slow. So that's the banded ankle eversion. So the next one is called banded ankle inversion. For this one, you're going to go up and in, and you're gonna go up towards the ceiling. So you're gonna pull this band down, pull it up and in, come back slow, up and in, come back slow, up and in, come back slow. So for both of those exercises, you want to do 3 sets of 15. So the next exercise is the seated Solus Raise. With this exercise, you're going to push down either with a weight or just onto your thigh there. Come up onto your toes, so lifting the heel up, come back down. And when you're coming up onto your toes, you want to feel the soleus muscle working, which is the deeper muscle underneath your gastroc muscles. I'll put a picture up there later for you. So essentially, this is going to help you strengthen that gastroc soleus complex. And a lot of people tend to neglect this one. So with this one, same thing, you would want to do 3 sets of 15. Just really concentrate on squeezing that muscle and push down as you come up. So after the seated calf raise, we're going to go into standing single leg calf raise. Come up onto your toes, come back down. So with the single leg calf raise, you want to keep your knees straight the whole time and come up onto your toes, come back down, up onto your toes, come back down. And you're going to do 3 sets of 15. So the next thing we're going to go into is to strengthen the foot intrinsic muscles to work on your balance. Stand on one leg. Try your best not to scrunch your toes. So keeping 3 points of contact on your foot onto the ground. And then you're going to hold it for about 30 seconds to 1 minute and see if you can go even longer than 1 minute. So that's the first variation, super easy. The second variation you can do is now we're going to go into a 3-way tap. Reach as far as you can. Again, try your best not to scrunch the toes, like so. If this is too easy, feel free to just keep reaching forward and forward. If you're doing this right, not scrunching your toes, typically you can feel a big burn here because you're actually working your foot intrinsic muscles a lot and also your calf complex when you're doing this. So I would do 5 reps, that's 1 set, and do about 2 sets of that. So we're just going to end this off with a plyometric move. I like to call this the skater hop. So with this one, you're going to work to stabilize when you're landing. So you're going to try your best to be stable as you hop back and forth. And me wearing socks right now is not the best. I would definitely wear shoes when you're attempting this, but basically that's essentially what you're doing, just adding that last plyometric component to help to stabilize your ankle. So that's it for this video. If you like the content, hit the like button below. I hope to see you in my next video.